Oh, thank you. Thank you for that applause. As you can see, Yoga Moves MS offers adaptive yoga that you can enjoy anytime and anywhere, and you can join our daily live and recorded classes. We're thrilled to see the response we had to these events. Today is our 6th year of providing an event of this kind, and 7th forum when we've had so much of this excellent attendance, which tells us this information and gathering is very important to our community. We have pulled together an amazing, and I mean amazing, rock star lineup of speakers who have in-depth knowledge in their respective expertise and topics. They will provide you with important research and concepts that are right hot off the press, state of the art. Thank you to all of our attendees. You are the reason that we're here. Namaste. Thank you to Beth Stone and Lori Spenson, who are with me here from Michigan today and make all of this possible. Raise your hands. Beth is standing in the back. Lori's in purple in the front. They think about the big picture, but also the teeny little details, and there's a lot of them that go into this. Namaste. Thank you to our amazing Yoga Moves MS instructors that teach our classes both in person and live. Thank you for the amazing work that you do with our students. You make important contributions every day for the community, and it does not go unnoticed. It's apparent and crystal clear that you are the best at what you do. I'm going to read their names in case they're listening. Mandy Bush, Anna Cairns, Jill Dunphy, Deborah Henderson, Betty Ann Hodges, Julie Levinson, Kathy McRae, Barb Wilker, and Marcia Williams. Namaste to our sponsors and exhibitors. We truly would not be able to put an event on like this without their generosity. Our top sponsor today is TG Therapeutics. Thank you, TG Therapeutics. Then we have Biogen and Amgen. And our exhibitors are Alexion, Bristol Myers Squibb, EMD Sereno, the Exercise Neuroscience Research Laboratory at the University of Illinois, Chicago, Genentech, iCompanion, Neurobalance Center, Novartis, and Viatris. Let's all take a moment to breathe in gratitude for all that brought you here today. That's your minds, your bodies, your spirit, your computers, your phones, your cars, anything that comes to mind. Take a moment and breathe in gratitude. Gratitude makes us happy. It makes us happy. You might have heard of the Happiness Project that Harvard did. So take a moment and let's say namaste to all that brought you here today. Without further ado, I would like to introduce our panel of speakers. Why don't you come on up here? Panel of speakers, 3 distinguished individuals. I see you guys coming in the back. You come up front. We want you up here. These look like comfy chairs. Thank you so much for being here today. Thank you. I'm going to read their bios because there's so much. There's no way I would memorize this. And then they're going to start their panel discussion. All right. So Dr. Augusto Miravelli, the chief of the Division of Multiple Sclerosis and Neuroimmunology, Associate Professor of Neurology, Department of Neurological Sciences at Rush University, Chicago. Dr. Miravelli is a board-certified neurologist who subspecializes in multiple sclerosis. Dr. Miravelli received his medical degree from the University of La Plata, am I saying that right? Argentina. He completed his neurology residency training at Loyola University, Chicago, where he served as chief resident of education. He subsequently completed neuroimmunology fellowship at Harvard University in Boston and a fellowship in medical education at the University of Rochester, New York. Dr. Miravelli is the recipient of the 2012 American Neurological Association Medical Education Fellowship Award, 2015 American Academy of Neurology Research and Education Award, and 2015 American Board of Psychiatry and Neurology Facility Education Innovation Award. Dr. Miravelli has been involved in both clinical and science-based research in the field of multiple sclerosis and neuroimmunology. He is a member of many professional societies and advisory boards. He's frequently invited as a speaker at national and international meetings. He's published numerous scientific articles and serves as a consultant to various scientific organizations. Oh my. Oh my, thank you. We're very honored that you're here today with all those invitations that you get. We're very lucky. Kathy Kiefer. She started her career in expatriate management working for a large European multinational. She continued her professional development as a compensation and mobility consultant, working with one of the largest international HR firms, assisting multinationals worldwide with developing sound policies and practices for their global workforce. The Brain Health Center of the Rockies was founded with an ambitious vision and big, open-hearted one. I can tell, it like radiates from her. To create a community in which everyone achieves their maximal brain health potential. Kathy received her degree of Bachelor of Arts from Kalamazoo College, Michigan, with a major in international affairs with a concentration on Western Europe and minors in German literature and anthropology. Kathy attended foreign studies at Friedrich Alexander Universität Erlangen, Germany. Upon graduation, she enrolled at the University of Strasbourg, France, where she received the premiere and deuxième degrees. She later completed advanced education in international relations, economics, and French at North Carolina State University. Wow. Kathy enjoys the outdoors and loves spending time with her family. Okay, Dr. Holland. This is the abbreviated version, by the way, just in case you were wondering. He's laughing because he's got multiple pages. Dr. Holland is a physician scientist affiliated with Rush University Medical Center, specializing in lifestyle and neuroepidemiology. His research focuses on modifiable risk factors and lifestyle interventions to enhance wellness and mitigate chronic diseases of aging. Dr. Holland completed his medical training at Rush Medical College and pursued postdoctoral research at the Rush Institute for Healthy Aging. His work, including studies on dietary flavonols and Alzheimer's risk, has gained global attention. How many people did you say? 4 million. Sorry, I wasn't exaggerating. It's 4 billion. 4 billion. Wow. Actively engaged in wellness initiatives, Dr. Holland serves on the Wellness Committee for the U.S. Pointer Trial. Furthermore, he contributes to Alzheimer's disease prevention advocacy efforts and holds leadership positions in professional organizations, such as serving on the Board of Trustees for Mind What Matters. Currently, Dr. Holland research explores the association between lifestyle interventions, various lifestyle combinations, and brain health, extending to additional neurodegenerative diseases like multiple sclerosis. He regularly presents his findings to academics and industry leaders. Additionally, Dr. Holland delves into pharmacoepidemiology and cognition, examining the role of lifestyle optimization in preventing COVID-19 and dietary modifications to improve neuroplasticity post-stroke. I gotta go breathe now and let you guys start. You guys are all amazing, and we feel so fortunate that you are here today.
So thank you, Mindy, for that wonderful introduction. And of course, thank you for the invitation. to participate here. It is truly an honor and a pleasure to be here. And I'm going to start us off, but this is going to be a panel discussion. We are going to introduce some topics related to brain health with particular emphasis in multiple sclerosis. However, as mentioned before, most of the principles that we now know that relates to brain health in MS perhaps started with research that pertained to Alzheimer's and dementia. And many of those principles actually apply to everything we do with or without multiple sclerosis, with or without any neurodegenerative disorder. These principles actually apply to brain health. So for a moment, I want to just forget about multiple sclerosis and think about the brain and that organ that actually controls everything we do, everything we think, but it's an organ that we have influence and control on. So many of the things we're going to talk today are things that we can actually apply in our life today, things that actually we can do. That doesn't matter if you have multiple sclerosis or not. Those are things that actually now we have evidence that helps to keep that brain as healthy and the optimal function of the brain as active as possible. And without further ado, let's just define the objectives for today. So we are going to discuss the scientific evidence that supports the incorporation of lifestyle interventions in multiple sclerosis. And then we are going to review models of care that aim to incorporate these activities into our lives with MS. So let's start with some myths that perhaps you heard or you even said that, some of those things actually continue to circulate online, and they prevent us from actually being able to incorporate these lifestyle interventions in our life. One of the things is, behavioral interventions don't change the course of the disease. Well, we know that that's not true, and we'll discuss some of the evidence that supports that statement. The other one that actually usually comes from us, from physicians or from healthcare providers, we don't have time to promote lifestyle interventions with our patients. And there is some truth to that. When we approach the care of our patients in 30-minute visit, we usually concentrate on things like the physical exam or taking a history, looking at an MRI, looking at the blood work, and we usually don't have time to talk about, tell me about your diet, tell me about your exercise, your quality of life, your sleep. So there is some truth to the fact that we don't have the time, but if we only look at the time spent in the clinic, but that doesn't mean that we should not incorporate these recommendations into the care of our patients. Also, there is another myth that usually circulates, that there are limited resources for MS patients with advanced disability. And as Mindy mentioned before, it doesn't truly matter how much disability someone accumulated. We can always do something to help our patients improve their brain health. And the last one, that is the one that actually personally insults me, and I'm sure everyone that actually is involved with lifestyle medicine, that lifestyle medicine is a soft science. Well, it is not. There is a lot of evidence coming from rigorous research publications that actually support the recommendations behind lifestyle medicine in multiple sclerosis particularly. So just to get us all into the same playing field, let's review very briefly what is the natural course of multiple sclerosis in today's language, to today's standards. And perhaps I've seen some of you that perhaps you had MS for many decades. And it's possible that in the past you heard your physicians talking about certain terms that now we are slowly not talking as much, like this concept of moving from a relapsing MS to a secondary progressive MS. Those terms are becoming less popular these days because we recognize that those clinical labels were established in the past when we didn't have biomarkers, when we didn't have our knowledge of the pathophysiology of MS that actually supported the knowledge that actually MS is one continuous disease, that in that journey, MS patients may develop certain symptoms and signs that we call relapses, and that's what you see here in these bars. So those relapses are very frequent early on in the course of the disease. And for those of you who wants to know more about that, the definition is right there, which is the presence of signs and symptoms that last at least 24 hours and is not explained by anything else. It's not explained by infections or fever or stress. And as you can see in the graph, these relapses, after they resolve, there is usually an accumulation of disability that lingers, and is a residual deficit that comes from that relapse. We rarely see that the recovery from a relapse is complete. So if you start accumulating problems after each relapse, in the course of someone's multiple sclerosis, there is going to be an accumulation that we now call relapse-associated worsening, also known with the acronym of RAW. So perhaps you've seen this term online, and it's good to kind of explain what that means. So that's one of the main contributors to disability, which is that accumulation of disability that comes as a consequence of an incomplete relapse. But as you know, that's the manifestation of something else happening behind the scenes. And I'm sure you had MRIs at some point. Raise your hand if you had an MRI for... See, I see a lot of hands. And I'm glad that's happening. MRIs, we use that as a tool to not only diagnose MS, but also to monitor the disease process. And not all the lesions in an MRI will cause symptoms. And perhaps you encounter situations in which you had an MRI, particularly early on, after having maybe one relapse, and to your surprise, that MRI showed 8, 9, 10 lesions. And what is that? What are these lesions doing to you? What are these lesions affecting? Well, those lesions are usually affecting what we call the brain reserve. Just show me your hands. Who is familiar here with the concept of brain reserve? All right, I see 4 hands. Hopefully at the end of today, everyone raise your hand. So what is the brain reserve? And that's exactly why we're here. Everyone that is doing work in brain health, the main goal for work in brain health is to promote a healthy amount of brain reserve. So for a moment, look at your brain from a functional standpoint as an organ that has 2 main functions. One is to do the things you want to do every day. That's the active brain that approximately equates to 10 to 15% of the amount of function that the brain can accomplish. But we have an amount of brain that is actually there to support other activities. Let's say tomorrow you want to learn something new. You want to learn a new language, you want to learn a new instrument, perhaps you want to do something new in terms of your physical function. Well, you're going to need additional brain in order to support that new function that you're bringing into your life. And you're going to start using neurons in your brain reserve. So if you translate your brain to your bank accounts, your active brain will be your check-ins, and your brain reserve will be your savings. So constantly we are transferring brain cells from our savings to our check-ins, depending on what we do with our life. So if you speak English as your main language, you're using a lot of cells in your language area, and they're specialized and they're well trained to speak English. But let's say tomorrow you want to learn French. Well, what the brain is going to start doing is using some neurons from your brain reserve in your language area and train them to speak French. And when you become proficient at French, all of a sudden you enhance the amount of neurons in your language area to have certain neurons that speak English, certain neurons that speak French. And that's how you learn. That's how you establish new functions in your brain, by the things that you choose to do with our life. So that savings account, that amount of brain that we have called the brain reserve, is something that early on, particularly MS lesions, could affect. And that's why you don't see that all the lesions that we have in MS will cause symptoms. Going back to your bank accounts, if someone is stealing money from your check-ins, you probably notice that right away. But if someone is constantly stealing money from your savings accounts, unless you're checking that every day, you probably won't notice until you need to use that money, and all of a sudden you see that your reserves are decreased. So that's the same concept of having lesions on the brain that are not causing symptoms early on, but as you age and you need to start using that brain reserve to compensate for aging, all of a sudden you're like, wait a minute, I don't have as much brain reserve. And that's when we used to say that someone with multiple sclerosis over time will slowly find this decline of neurological function. We used to call that progressive MS. We still call that progressive MS. And we used to say, well, someone goes from a relapsing to a secondary progressive. Now we are thinking of these processes as simultaneous processes that are happening together. So as patients accumulate disability from relapses, they are also accumulating disability for that slowly progressive phase of the disease. That the term that we use today is progression independent of relapse activity. So those two processes are happening simultaneously. And the goal for therapy is to be able to identify them and to be able to stop them. So here I also added the neurological reserve or the brain reserve. And as you can see early on, it's going to be there in the background trying to mask or compensate for the damage that is being caused in multiple sclerosis. But as the disease continues, there is going to be a point in which the exhaustion of that neurological reserve, it's not going to be able to compensate for neurological function. And at that point, when the neurological reserve is no longer able to compensate and progression continues to accumulate, that's when we see that patients actually start to slowly manifest those symptoms and signs of progression, slowly having difficulty walking, needing to use a cane for ambulation, slowly having this cognitive decline that appears to be affecting everything that patients wants to do in life. Any questions or any comments? And there's going to be plenty of opportunity to ask questions at the end, but anything burning that now I need to clarify? Oh, there are two questions, okay?
Thank you. Is there any contraindication for, how's it pronounced, Charcot-Marie-Tooth patients to practice yoga? Any contraindications for that?
Okay. So that's a great question. So patients with Charcot-Marie-Tooth, which is a type of hereditary neuropathy, it can present with different types of Charcot-Marie-Tooth. And patients usually have anywhere from sensory to motor deficits. So indeed, there is no contraindications, but usually what I recommend in those patients is to have a visit with a physical therapist to make sure that it's safe to do any type of physical activity, particularly to prevent falls. Sometimes these neuropathies in Charcot-Marie-Tooth can cause decreased proprioception, which is the sense of balance when we are not looking. And sometimes some of the yoga poses that you can do may trick the brain and you may fall. So what I will recommend is perhaps have a visit with a physical therapist to make sure that it's safe.
Just so you know, these questions are coming from our virtual audience.
Okay, I figured that out.
Yeah, the second question is, can MS lesions be a cause for seizures? If so, would seizure medication be effective?
That's a great question. So going back to the lesions here, so the location of lesions varies, and MS can affect pretty much every component of the central nervous system. In the past, we used to think of MS only as a white matter disease, but now we know that MS can affect the gray matter as well. So when these lesions are very close to the cortex in the outer layers of the brain, they could eventually irritate that cortex around the lesions, and that can manifest as seizures. So lesions can cause seizures. It's rare. It's not a typical presentation, but it could happen. And in that case, we usually recommend treatment with anti-epileptic medications to decrease the likelihood of seizures in the future. Very good. That's an excellent question. Yes, sir. Excellent question. I'm going to repeat that for the audience. So the question is, we see a decline in neurological reserve as we see here, right? And that happens as natural history. So the question is, can we reverse that and bring the neurological reserve levels up? And the answer is yes. And that's why we are here. So what are the things that we can do to bring more money into our savings accounts, right? To improve that neurological reserve. And that necessarily doesn't mean to have more neurons, but means can we make the connections between the neurons that we have more efficient so that through training, we can make the whole system be more effective for what we want to do? And the answer is yes. And that's why we talk about exercise, we talk about healthy nutrition, we talk about lifestyle interventions that makes a difference. Okay, so I need to speak on the microphone that one. So thank you, Kathy. These are just for those of you who wants to know a little bit more about that savings account, the neurological reserve. We always say, well, there are two types. One is what we call the passive brain reserve, which is your hardware, the amount of brain that we have, the amount of neurons, the size of the brain. And that's usually determined genetically. And when we are born with X number of neurons. And there is little we can do to truly change that. And that's how we are wired. And MS can affect that, of course. And have you heard of brain atrophy? So brain atrophy is a process of shrinkage of the brain. All of us here, as we age, we go through a process of atrophy. And that happens just naturally as a consequence of aging. But in multiple sclerosis patients without therapies, that rate of atrophy could be as high as 1 to 1.5% per year, whereas in healthy aging is approximately 0.2 to 0.4% per year. So we know that if we don't treat multiple sclerosis with therapies, there could be an accelerated rate of atrophy. Some of the medications that we have approved now, particularly those highly effective therapies, can drop the likelihood of atrophy to levels that are comparable to healthy aging levels. So that's one of the benefits of being in certain medications for MS. But the other brain reserve, that's the one that actually we can shape and we can influence with the things we choose to do in life. Also known as the active brain reserve. That's your functional brain. That's how your brain works. Going back to a computer, that will be your software. How many programs you put in that computer of yours? How many functions you ask your brain to do? And we can influence that brain reserve through the things we do in life, our educational attainment, our physical activity, our diet. And that's the part of the brain reserve that actually has the most influence by the things we choose to do. So we kind of covered this already, which is that concept of brain atrophy. And for those of you that like numbers, these are the rate of brain atrophy that we see in healthy controls, MS patients without medications, and as I mentioned before, in individuals that are receiving medications, it's reasonable to expect a benefit that could be measured with atrophy rates similar to those individuals that are healthy aging without multiple sclerosis. But let's talk about the function of the brain. Have you heard of a functional MRI? I see someone say yes, absolutely. So a functional MRI, well, it's a technique that doesn't look at the structure, but looks at the function. So how the brain works in response to certain activities. And as you can see here, that was a healthy control that was asked to perform a motor function. And in this case was finger tapping. And what the functional MRI does is measure the parts of the brain that get activated as a consequence of that function. And anything that you can see in orange and red are parts of the brain that individual is using in order to perform that function. It's kind of cool, don't you think? So it gives us a sense of how the brain is working, what parts of the brain are active. So the investigators did the same task in an MS patient. And this individual had the same age, the same gender, but had multiple sclerosis. And they asked this individual to do the same function. And when you compare the two, which one has more red and yellow, the top one or the bottom one? The bottom one, right? Full disclosure, if I give you options, the correct one is always going to be the second one, okay? So that now you know, you have no excuse. So very good. So exactly. So the bottom one has more brain activation. What is that telling us? So that's telling us that that individual, in order to perform the same function, had to use more brain, had to use more parts of the central nervous system in order to accomplish that function. Would you agree? Excellent. So now the question for you, this is just finger tapping. But now imagine that that individual has to go to the grocery store, has to take the kids to school, has to come home and make the dinner, and has to do all the things that we usually do on a day-to-day basis. And for everything you do, you're activating more brain cells. How do you think that person is going to feel at the end of the day? Exhausted, right? Well, that's one of the ways, a very visual way to understand fatigue in multiple sclerosis. Why are we tired? Well, because you're constantly having to use more of that brain to do the things you want to do. You're constantly having to recruit more brain cells from your brain reserve to be able to do the things you want. So usually when I show that to my patients, that's one of those moments in which like, well, now I get it. Now I understand why I'm exhausted at the end of the day. My entire system is being asked to perform at a higher level to be able to compensate for those lesions causing demyelination and making the whole system feel slower. Okay? So going up to a question that I was asked before is, can we make this whole system more efficient again? Can we retrain our brain to go from this state to that state again? What do you think the answer is? Yes, and that's why we are here. Very good. So let's look at another study that now looked at motor training in an MS patient as a way to improve plasticity. And this is the first time I mentioned the word plasticity. But at the end of today, not only are you going to be an expert in brain reserve, but also you will be an expert in plasticity. So what is plasticity? It's the ability of the brain to rewire, to change the way the brain cells work, the efficiency in the system. So they did another functional MRI study in an MS patient, and this is a baseline scan, and it's kind of small, but hopefully you can appreciate the fact that there is a lot of orange, there is a lot of red, and a lot of yellow. And again, that was a patient that was asked to do a motor function. So that individual was activating a lot of brain cells in order to perform that motor function. So what they did after that study is they asked this patient to enroll into a 3-month-long physical therapy and rehabilitation program. And the whole purpose of that program is to retrain that individual to perform that function better over time. So at the end of those 3 months, they did another functional MRI. And what do you think happened? Improved. And the amount of brain that individual had to use to perform that function was significantly smaller. So what this is telling us is that brain, and all of our brain is the same way, is very trainable, very plastic. We can actually modify the efficiency of that function by the things we choose to do. And particularly if you train that function with the proper exercises and the proper guidance, you can expect to see improvement in the efficiency of the brain. So let me ask you, and that was not part of the study, but let me ask you, how do you think that individual will feel at the end of that 3 months training? More fatigued or less fatigued? Exactly. And that's the whole point of understanding how exercise, how physical activity can not only improve motor function, but actually improve the way we feel after we do that activity. And even though it may sound counterintuitive for you when we say, hey, you're tired, you're fatigued, you need to exercise more, it's like, wait a minute, that is like opposite of what I thought I need to do. Well, that explains why. Because yes, you may be more tired at the end. It will get worse before it gets better. But with proper guidance, we should expect that the whole system becomes more efficient, so you actually can do more and you can be less tired. Is this making sense to you? Good, excellent. How about people with minimal or no motor function? Can you get the same benefits? And that's one of the things science becomes a little bit more this mysterious area that, this study reminds me of how wonderful the brain is and how many things we don't know about the brain. So this study looked at individuals without legs. Those were amputees. And they were comparing with people with legs. And they asked the individual without legs to think about, imagine moving those legs. Kind of crazy if you think about that. And they compare the amount of cortical activation in the amputees versus the control. And you can see that there is a lot of concordance in the amount of areas that activated the brain by just thinking about movement, even though they didn't have the lower extremities. So this is a pilot study published last year, and we're going to start to see a lot of this because the whole point of this study was to say, well, let's say someone has minimal motor function in lower extremities. You unfortunately are in a wheelchair with minimal function. But can we still train your brain to think about movement in the same way that you will routinely exercise? It's not just think for a second. Imagine the movement, right, left. You go through the whole routine in your head. And can we expect similar benefits in the whole amount of use of that neurological reserve as individuals with movement? So more to come, but that's something that I want to plant a seed in your head to start thinking about how wonderful the brain is, how many things we can do even in the context of minimal motor function. Is movement the only thing that we can do for our brain? No. There are many things that actually have benefits in our brain health that go beyond just movement. And one of those is music. And I think all of us here share a passion for music, myself included. And music, when we are exposed to music, is a comparable amount of brain activity that we get pretty much with every aspect of the central nervous system, comparable to a workout. So music it functions as a stimulation that can promote neuronal plasticity. When you look at, for example, musicians, MRI studies looked at the brain of musicians compared to the brain of non-musicians, and they found that certain parts of the brain are larger, particularly one area called the corpus callosum, which that's very thick bridge that connects to right to the left. That's an area that is affected in multiple sclerosis. And individuals who actually play music as a professional activity, they have larger areas consistently, including the corpus callosum and the cerebellum as well. But listening to music, you don't have to be a pro. If you listen to music, has a profound effect in things like working memory, anxiety, and depression, which are very common problems in multiple sclerosis. So I believe I have a few more minutes left, but I'm going to dive a little bit deeper into an area that is a passion of ours. And Kathy, in a few minutes, she's going to explain to you a program that we offer called the Brain Health Program. And the reason why we have this is it's extremely difficult to understand all the things that we know in MS brain health in one setting. Probably after today, you may leave the room inspired and you probably learn something, hopefully, but it's extremely difficult to learn all of these aspects in one setting. So what we have established in the nonprofit that we funded, but also at Rush, is a longitudinal educational program that will allow patients to understand these complex topics in a way that is in a better pace, and also using a mechanism called planned redundancy, which is if you have to explain something complex, you have to introduce that topic in multiple sequential longitudinal ways. And every time you explain that, you increase the amount of details and you dive a little bit deeper. So at the end of that program, you truly become a pro. So we apply that principle in the 3-week brain health program. But I'm going to do just a small sample of that today. So now you know the whole concept of brain reserve. We talked a little bit about efficiency, but let's dive deeper. Let's go to the cellular level. This is what a neuron is, and that's our brain cells. So as you can see there, it's very complex. You have DNA, you have RNA, you have proteins, receptors, and then you have this concept of called dendrites. That's how neurons talk to each other. So it's simple to think about neurons as a simple cell, but it's actually a very complex cell. And the amount of dendrites and the amount of chemicals that go in between those dendrites have a profound effect in brain function, has also a profound effect in mood, in depression, in anxiety. So I'm going to just walk you through the evidence that we now have that exercise affects the neuron, and exercise affects all of these components around the neurons. So the first one is perhaps the easiest one to understand. So exercise promotes neurogenesis. If you are my age or older, and if you went to med school, probably you learned that we are born with X number of neurons, and you can't make new neurons. Well, we now know that that's no longer true. There is a process of neurogenesis, particularly in parts of the brain called the hippocampus, which is in the temporal lobe. That's the area that actually allows us to remember, to learn, to memorize. So you can create new neurons in certain parts of the brain. And exercise is one way in which it's been established that individuals with or without MS can improve the number of neurons in that particular area. So now that you know that, and you know that the hippocampus controls memory, what do you think is going to happen in people who exercise with their memory? Gets better. So, and that study looked at individuals that were at baseline very fit. They were doing exercise for more than 150 minutes per week for 6 months. They looked at individuals that were not doing exercise, and they were looking at individuals with a cognitive function at baseline. And all three groups actually had a benefit, but guess what? The individuals who were at baseline more fit and increased the amount of exercise got higher, better benefits. So there is a dose response that we see with exercise. It helps everyone, but actually you don't need to wait until you have a problem to benefit from the exercise. If you start doing exercise before the problem occurs, actually you get better benefits. So that's one of the reasons why we promote the use of exercise in MS care. Another area, this is a way to improve the connections between neurons, something we call long-term potentiation. So we talked about these neurons talking to each other. So exercise also showed to benefit the efficiency of the communication between neurons. And in the interest of time, I'm going to go a little bit faster, but something that Dr. Holland is going to talk about today, which is the role of prevention of disorders, chronic disorders in general in brain health. Exercise was found to have a profound effect in preventing diseases, particularly cardiovascular diseases, in individuals in large studies. This is Dr. Mottle's slide, and I have to say I have to give him credits for everything he has done. And those are the benefits, the summary of benefits of exercise in different parts, not only in improving muscle strength, balance, decreasing fatigue, but also if you pay attention to this area, his lab suggested that exercise actually can be seen associated with decreased relapse rate, decreased lesion volume, and improvement in certain structural gray matter structures like the thalamus. So how often we recommend? So there are now guidelines that gives us a sense of the type of exercise, the amount of exercise, and whether it's aerobic, whether it's strength training. And we share these guidelines with our patients at Rush. And of course, we share these guidelines in the 3-week brain health program that we offer. And we talked about music, we talked about exercise, but also other aspects of brain health are important. Here is a very brief summary of nutrition. Dr. Holland is going to talk to us more about nutritional strategies in brain health. Vitamin D deficiency, we know that is a risk factor for MS, and also is a factor that when corrected can make the course of the disease better. And also smoking cessation is critical. Smoking is not only a risk factor for MS, but also can be associated with worse clinical outcomes in individuals with multiple sclerosis. So what do we do now? So we kind of very briefly discussed some of the evidence behind lifestyle interventions in multiple sclerosis to promote brain health. So the big question now is, how do we apply this into the life of our patients? How do we help individuals accomplish brain health? So kind of moving from the what to the how. And before we do that, we need to help patients understand the why. So I thought to share with you a case. This is a case that I created. It's not representing a real patient, but in a sense, it's a patient that perhaps represents a common scenario that we see in clinic. So Lisa is a 45-year-old woman diagnosed with MS at the age of 32. She received treatment with a medication called Tecfidera, however, discontinued due to side effects. And she decided to never start another disease-modifying therapy because she wanted to follow a natural approach. Lisa works full-time. She has a graduate degree in business administration, and she read somewhere along her journey a book about the health benefits of celery juice, and then became an advocate for celery juice in multiple sclerosis. And now she's complaining of severe fatigue, has 2 new lesions on the MRI. So this is not unusual. We have encountered situations like that. And the challenge that I pose here is we want to honor Lisa's approach to being healthy. We want to honor Lisa's approach to natural. However, we also want to offer Lisa all the tools that we have that we know that have a benefit. So how do we reconcile everything? How can we honor Lisa's wishes, but at the same time helping her getting the benefits from everything that we know that can help in multiple sclerosis? And this brings us to Google and online and data. And everyone now is bombarded with data, and data is at our fingertips, and we hear things from colleagues. We go to a meeting and we hear something from the person sitting next to us, and we go online and these social media platforms, they learn very quickly that we perhaps have MS, and they're going to start sending you all this information every time you go to Facebook or to go online. So data is everywhere. But data doesn't necessarily mean that it's information. So information is when we can start putting that data into a story, something that actually makes sense, something that information will have some degree of context. But information could still be not accurate or not valid. Information could be evidence-based, and that's when it comes from rigorous studies that looked at research and tried to provide evidence behind that information. Information could be opinion-based, and we are exposed to that constantly. Some of that opinion could come from substantiated, valid reasons. Some of that opinion perhaps is biased, and I will argue most of the opinion that we have some degree of bias. And then you have flat-out misinformation, information that is not accurate. So how can we navigate all of this? But there is another step. So when you start putting pieces of information together, that's when we build knowledge. And knowledge is something that helps us sometimes to answer questions. Knowledge is something that can help our patients say, well, what is the best course of action that I should take for my multiple sclerosis? What is the right diet that I should follow? What is the right amount of exercise? Well, if that knowledge came from information that is evidence-based, that's wonderful. That's when give patients wings and empower patients to be able to take control and be your best advocate. But when that knowledge comes from obscure sources and from misinformation, patients can end up in a situation in which they believe in things that may not be real. And so how can we help patients actually get to the right information, the right sources, build the right knowledge to ultimately get what we all hope, which is improve your healthcare literacy so you can empower yourself to take the best control of your life and be your best advocate. So as you can imagine, this journey is complex and is very difficult. And as I mentioned before, it's nearly impossible to cover all of this in one setting. And it's very challenging also to do it in the clinic when we are usually distracted with looking at MRIs and looking at side effects and trying to address, more urgent matters. So for that reason, we decided to build a program that hopefully will expose our patients to evidence-based information. There is some opinion-based information, but it's opinion that comes from individuals who have expertise in that area with the aim to improve our patients' healthcare literacy. And with that, I would like to pass now the microphone to Kathy Kiefer, who is going to walk us through how this program looks like. But before I do that, I want to answer that question.
Is that slide deck available to us?
I think we can make it available, right, Mindy? I'm happy to make it available for you. Okay, it will be in the virtual exhibit hall. All right. So now Kathy is going to walk us through how do we go about providing this service to our patients.
Thank you, Dr. Miravalle. Thank you, MS Yoga Moves. This truly is an honor. So as Mindy had mentioned in my bio, I do not have a science background. My background is something entirely different, but I have come to love this work more than anything that I've done in my corporate field or in the consulting realm. So talking about education, and again, I think that's a really vital role of the piece of patient care. And as Dr. Mirabale had mentioned, oftentimes time is just too short when you're in the clinic with your MD. And I think it's really important to kind of break down the pillars so that patients truly know the various resources that are available to them. And that goes beyond just your doctor. It is looking at, your overall nutrition, your level of exercise, your sleep and comorbidities, anything else that might be going on in your lives, your social aspect, your cognitive realm. So, of course, the emotional and anything else that might be happening. So these are really the pillars around brain health that need to be stressed and I think are really a part of our lives, right? So let's kind of break this all down and look at health in a much larger realm. So I think the American Academy of Neurology has a great definition of brain health where they say a continuous state of attaining and maintaining the optimal neurological function that best supports one's physical, mental, and social well-being through every stage of life. So again, it's a much bigger picture. And I love seeing that brain health is becoming such a hot topic these days and receives a lot of focus and concentration. So what have we done? And again, we've started a multiple sclerosis brain health clinic through the nonprofit that we co-founded out in Colorado, the Brain Health Center of the Rockies. And I've been running an MS brain health program for almost 6 years now. But we have been fortunate enough to see that there is enough attention by various large institutions. So we are now taking this to Rush. And as part of that, there are components that go along with it. So we want to make sure we are providing the education that patients feel empowered, they can advocate for themselves and truly understand the resources that they have. So that's where I host our MS Brain Health educational program. But we want to integrate that with the care that they receive within clinic. And then, of course, building that into a research component as well. So that kind of is the full circle of what is provided at Rush. And is a big part of the overall brain health program. So I'll kind of go through that quickly. So I think a big part of all of this is talking about the change cycle. And the big aspect is, first of all, identifying the problem. What is truly happening with this disease diagnosis that you have received? What are your symptoms? What is the problem? So identifying the problem first and foremost. Then is a question of why, and truly understanding the problem. That's where, again, the education piece is super critical. Then we want to see that from the education pieces and things that you learn, that you are actually putting that into execution and you actually make that a part of your life. Then let's make sure we're assessing that things are happening the way they should. So assessing outcomes and that is being maintained. So we want to make sure that there is the full circle of implementation for better brain health. We'll go through this a little bit quickly. So again, identifying the problem, assessment of physical, emotional, and mental status during a clinic visit, conduct a baseline outcome, and then developing a personalized brain health plan. Now, I think I want to focus in on the personalized piece of this because there are a lot of large, wonderful webinars provided to patients. But what has been hypercritical in the programs that we have established and has been vital for me all along is to make sure that I touch every single patient that comes through and does this program with me. And what I mean by that is I like having those smaller group settings over an extended period of time where we can truly interact with one another, that the questions are being answered that are specific to you. So having that personalized approach, I think, is where ultimately you gain the most, because you're feeling like you're being heard. So this is the patient education and for medical intervention. So again, I am running that 3-week brain health program. We also provide monthly conversations in brain health. So this is all somewhat interconnected. And then making sure that we have a larger get together, some kind of an annual event, because we all enjoy those social events. So this is part of ultimately the bigger understanding the problem and implementing this into more of a longitudinal approach. So after you have completed my 3-week program, I don't want you to think, okay, slap my hands and I'm done. We want to make sure you continue to stay engaged with updates that are occurring in the brain health realm. So that's ultimately where that all comes together. So we have, over the last several years, taken various approaches to this MS Brain Health program. We started out doing things in person, which was great. We would meet every Friday morning. But then COVID, like everybody else, we had to take it to a virtual platform. We maintained a similar format, just having our instructors teach. But what we have found to be the most effective is what we call a flipped classroom model. And this is where I have you as my students do some homework up front. This seems to be really effective, where we have pre-recorded videos that we suggest that all of the participants watch prior to our debriefing with instructors for each session. So we want you to come prepared to class. So you watch the videos, we get together with the instructors, debrief, and kind of hit high-level topics during that session, and then allow for Q&A. So that's kind of this approach of, again, upfront learning and making sure that during our live sessions we are the most productive, and that we're really kind of honing in on specific topics and terms. So this is ultimately a little bit of a demonstration of our online videos that we provide. Each day we have broken out, there's 6 sessions of the 3-week program. And we go into, I think it's my next slide. Yes. So I'll talk to this first and then I'll go back. So day 1 is really more going into the epidemiology, risk factors, kind of this MS 101, so we truly understand the disease itself, and talking about disease-modifying therapies. Day 2 is more talking about building your brain reserve and cognition. Day 3, we've noticed that we used to have it separated between physical therapy and talking about your physical well-being, where we had physical therapy as a separate topic, because exercise is actually proven to be one of the most effective realms of brain health. I mean, there's the most data behind it. So exercise deserves a lot of attention. But I have partnered that session together with occupational therapy simply because oftentimes a lot of individuals get confused around, well, when should I be seeing my physical therapist and when should I be seeing my occupational therapist? And there's most definitely a lot of overlap. So that is our day 3. Day 4, I like to break it up with some fun. So everything is kind of front-loaded at the beginning of the program, a little bit heavier, but you have to introduce some fun and easy ways to integrate brain health in a simple format of music. So we have music therapy on day 4. Day 5, Dr. Holland, who is sitting right here, is my nutrition guy, and really talking about the gut-brain connection. What is causing potentially inflammation that is, causing a flare-up of symptoms based on, the food that your nutrients that you're putting into your body. So it's a very important element of brain health. And then day 6 really is talking a little bit more about symptomatic therapy, kind of closing that loop of what Dr. Miravalle was talking about earlier, of brain reserve, making sure we really drive home that these are the important factors that contribute to your overall brain health and how you can maintain brain reserve. So ultimately that's, and I'll real quickly go back. This ultimately is kind of how it's set up for patients, where they can go in and watch videos for each of those breakout sessions. So we've been very fortunate to kind of do the pre and post evaluation of how these programs have worked, and have had some really great outcomes in the data that of effectiveness, and that it actually has provided a better understanding of the disease state, understanding the resources that are available within their community and who to reach out to, but ultimately benefiting in more of a long-term effect to maximum brain health. So I think that might be it. Well, yeah, I think that's pretty much it. We've talked mostly about this already. Yes, so I will turn this back over to Dr. Miravalle.
Thank you, Kathy. And as Kathy mentioned, so this is underpinning of all of that is a research program that we are building up. So we currently have the clinical component pretty much established, which is all these outcomes. And we are working with incorporating serum-based biomarkers and MRI biomarkers. And so as you can see in the long run, this is longitudinal intervention that we have from the clinic space that patients have a one-on-one consultation with a nurse practitioner, Adrienne Castillo, on brain health, where she does truly take her time to look at all the different aspects. The educational program that Kathy mentioned, the 3-week brain health program, the conversations on brain health, and then the development of that personalized plan and that longitudinal assessment. So with that, we are hoping that over time, with everything that we discussed, we can bring that level of neurological reserve as high as we can. We can stop relapses with our therapies that we have, and we can hopefully help to beef up that savings account in our brain so we can do the things that we want to with minimal problems. So in summary, hopefully I can convince you today that all these myths that we discussed before, that lifestyle medicine is a soft science, that we don't have the time, that we don't have the evidence, well, We do. We do have now the evidence that lifestyle interventions make a difference in multiple sclerosis. I will argue that neurologists, we should be playing an active role in promoting lifestyle interventions, whether it's through programs that we can educate patients and communities, or through active process of referrals to all the different players in healthcare that can actually help us, helping our patients to accomplish ultimately optimal brain health potential. And with that, I want to pass it to Dr. Holland now to take us to another area, which is nutrition. Thank you.
Thanks. All right. Okay, we'll get this figured out. So, first, I see you all have food now, getting it going. How appropriate that we're going to be discussing dietary interventions along with other lifestyle factors. So, today, I'm going to provide some information on risks for cognitive decline, dementia risk, and tie that in with the lifestyle factors, but how our lifestyle factors are going to impact the progression of a lot of different disease processes. So, a mentor of mine said that the best life or end, if you will, would be that you're 90 years old, you have all of your cognitive abilities with you, you have physical functionality, you are able to go ski the slopes, finish your day, have a glass of whiskey and a great conversation and go to bed that night and not wake up. That would be ideal, right? We're 90 and we have everything intact, both cognitive and physical functionality. But for a lot of us, that is not the case. There is either going to be a progression of decline in physical functionality or a progression in cognitive decline. We're going to be going over navigating life with MS, but how those lifestyle factors can impact us over time. All right. So, basics. We know with multiple sclerosis, it's going to be a disease of the central nervous system, and it revolves around the demyelination of the neurons. So we're going to be going into a lot of the physiology of the disease process itself. It's going to be characterized by sustained inflammation with eventual neurodegen. And the presenting symptoms can be as simple as lid lag. Somebody wakes up and they have some vision abnormalities, or it could be foot drop, where we're walking along and all of a sudden our foot starts dragging, and eventually, dependent upon the sidewalk you're on, could lead to a fall. So some of the factors that are going to be affecting the pathogenesis are going to be genetic, but there's also going to be other things involved. So that could be environmental factors. It could be viruses. It could be underlying comorbidities. Now, one of the main things that I do a lot of research in is the oxidative injury. And so whenever we talk about oxidative stress, we're usually talking about the immune system itself. So the immune system and an inflammatory response is normal functioning. But within our cells, we have these reactive oxygen species that are meant to break different components down. But sometimes those oxidants are going to cause oxidative stress. We're also going to have an inflammatory response. And that inflammation is very good, but sometimes that inflammation is going to be either increased in amplitude or increased in duration. And that can lead to cellular damage and eventually, if that's in the brain, causing damage to neural tissue. So we need to first identify populations at risk, because if we can understand who's at risk, we can start thinking about what we need to do to modify those risk factors. So elderly individuals, especially greater than 60 years old, minority populations, so specifically African American and Latino American, are going to be at increased risk for progression of disease process. Also, sex determination, although it's inconclusive, there is data that suggests that males are at higher risk for more intense adverse outcomes. Also, immunocompromised. So if the immune system is already not functioning appropriately, the capability to function normally later on is diminished. Now, these underlying comorbidities, the one thing that I see whenever I look at this obesity, cardiovascular disease, hypertension, diabetes, all of these have an underlying low-level chronic inflammatory process. And so if our bodies are primed with a low level of inflammation, the likelihood of spiking a flare is higher. So if we can diminish these comorbidities, we're diminishing the level of inflammation and the likelihood of a flare. So what is going on with MS support mechanisms? We have immunosuppressants, we have steroids. This could be dexamethasone. And the big mechanism behind dexamethasone is that it's going to modulate the inflammatory damage in an effort to reduce that disease progression, or either prevent a flare or recover from a flare. We also are going to have anti-inflammatories and monoclonal antibodies. So in contemplating on MS, the one thing we really want to do is mitigate the inflammatory flares. So we want to prevent them altogether. Now, a lot of the aforementioned comorbidities are going to be pro-inflammatory. And because they are pro-inflammatory, if we can stop those comorbidities or prevent their progression, we're going to see that we can prevent the onset of flares in a lot of individuals. And as we said, with Latino Americans and African American children, they have a higher risk of low-grade inflammation compared to white peers. So again, the aspect that the body is primed for an inflammatory process. And a lot of signs and symptoms have direct inflammatory components leading to actual demyelination, which then we're going to see as on MRI. So there's a lot of different ways to mitigate these signs and symptoms. When initially thinking about the disease process, the best way to attenuate the adverse outcomes is to avert the disease altogether. When we're in medicine, the one thing we say whenever somebody comes in with a disease process is, how can we remove the offending agent? And in this case, the offending agent could be this environmental aspect, lifestyle factors that are not primed for what we're doing and how we're functioning. So the former is done by preventative efforts, and the latter by removing that offending agent and treating the underlying disease process. So as mentioned previously, it's generally understood that a lot of lifestyle factors can be used as a primary or combination intervention. So as Dr. Mirvallo was saying earlier, the idea that you could take a medication and prevent a disease process is wonderful. But there's also the other side where individuals, the medication's not functioning appropriately for them. So how do we marry the idea of lifestyle factors and wellness and mindfulness with allopathic traditional care? So diet. And diet is going to be enveloping nutrients, so vitamins and minerals, as well as bioactives. So a healthy diet, like the Mediterranean diet, the MIND diet, or DASH, and MIND is the Mediterranean and DASH intervention for neurodegenerative delay, has been associated with improved cardiovascular health, diabetic glucose control, brain health, and weight loss. Also, at Rush and abroad, we've been investigating the potential role of anti-inflammatory and antioxidant properties of lifestyle modifications on several outcomes. So we are particularly focused on brain health and diet patterns, but what are those diet patterns? So the diet patterns themselves were developed because we looked at nutrients that were beneficial for brain health. We then looked at what foods contained those nutrients, so the foods and food groups. And then a pattern started to form, and that's how the MIND diet in particular was developed. So considering dietary components can act as pro and anti-inflammatory dependent upon what's consumed, diet is being investigated as one of those modifiable lifestyle factors. So if we're intaking foods that are going to be pro-inflammatory, we're going to see that that's going to elicit more flare. And if we're intaking foods that are more anti-inflammatory and antioxidant and allow for better immunomodulation, we're going to see that those are going to either prevent flares or decrease the duration of a flare. So expanding on physical activity in MS, one thing we were talking about earlier, the idea of foot drop and falls. Falls are one of those instances that lead to a lot of disability. The recovery process can be quite a long time. So whenever I talk with individuals about physical activity, it's always a matter of how do you do it safely. For a lot of us, I included, I started aqua aerobics. It is one of the most intense physical activity I've ever done. And it also removes gravity from the equation and is going to lead to less instances of injury. A lot of those low impact exercises are going to be quite beneficial. So that's going to be ellipticals, rowing, biking, things like that. Now, the one thing to keep in mind with physical activity is there's a quality and quantity aspect to it. So with our quantity, a lot of times what I like to see individuals do is about 150 minutes per week. And that's the American Heart Association's recommendation. But to delve into that a little bit more, we want to split that up. We want to do probably 5 bouts of about 30 minutes of moderate to vigorous physical activity. So it is moderate to vigorous physical activity. It's that whenever you're done, you could still talk to somebody, but you're probably going to have to breathe a little bit heavier. And if it's quite vigorous, you're probably going to have hands on your knees, pretty tired, out of breath. So really engaging that type of physical activity. And the reason being is that we're trying to optimize our cardiovascular system. So physical activity has also been found to have an association to reducing inflammatory cell production and improve neuroinflammation. So if we can have that capability to stave off or diminish inflammatory processes, we can either prevent the flare or again, diminish the duration. And as far as quality of physical activity, aerobic is where we typically sit with regards to how it's impacting overall health. But strength training has been independently associated with improved cognition. And then there's also the aspect of stretch and balance. And stretch and balance allows us to be a bit more cognizant of our bodies, but also really improve our capability to do other physical activity and prevent injury. So are other lifestyle factors that can modulate aspects of multiple sclerosis. So if obese, weight loss through diet and exercise can improve the outcomes through inflammation reduction. Again, obesity is in and of itself an inflammatory process. And again, priming that system is going to cause or lead to a higher likelihood of flares. Smoking. As Dr. Mirabali said, smoking reduction and cessation is ideal. Smoking in and of itself causes damage to the vascular system. It causes an increase in inflammatory biomarkers. So smoking in and of itself can elicit flares. Other lifestyle components. So socialization. This really gets into the idea of community. And socialization has been shown to improve our cognitive resilience, cognitive reserve, and neuroplasticity. So being engaged in just in social activities is very good. Now, what is socialization? Typically, we think of it as just being out and about and around people, which is great, but having deep-rooted relationships is even better for our cognition. And whenever we think about socialization or loneliness, you can be alone and not feel lonely. You can be in a social environment and feel lonely, or you can be not alone, feel lonely, alone, not lonely. But point being is that loneliness has a very profound impact on cognition, to the point that somebody that feels alone, it has the same impact on cognition as somebody that has had a 15-pack-year history of smoking. Now, inadequate sleep and stress can lead to low-level chronic inflammation. So sleeping. I like to lean into the 7 to 8 hours of sleep at night, but we also have to, again, take into account quantity and quality. So quantity would just be the raw number, 7 to 8 hours. Quality, what are you doing before you go to sleep? Are you watching TV? Is there screen time? Are you eating? Are you drinking? What is the sleep hygiene that gets you the best rest? And that's very important, especially when it comes to the stress biomarkers. So final thoughts on the disease. As much of the data here is either preliminary or attributed through connections to other disease processes, it can be used as potential guide for our further research. There is recognition that modifying all lifestyle factors hindering individuals is quite difficult. I have talked with individuals that want to implement one at a time, and we go over what is their low-hanging fruit. For me, diet has always been a little challenging. I was raised very meat and potatoes, and so I love meat and potatoes, but it's not the most ideal diet. So I have to be very cognizant about how I modify diet. But for me, physical activity, and instead of doing a lot of strength training, I split my time between aerobics and strength. It's not ideal, but it was low-hanging fruit for me. So what is the low-hanging fruit? What can you modify, and how easily can you start implementing these lifestyle factors? As we do with smoking cessation, understanding the motivations and where someone is with regards to readiness. So going through pre-contemplation, contemplation, having a plan, and then putting that plan into action. One thing that I talk with individuals about all the time is what happens if you fall off the wagon? What gets you back up? What's your motivation? Because there will be relapses at some point. I, for one, again, I enjoy red meat. I don't consume it all the time, but I'm going to every now and then. But I'm going to be very diligent and thoughtful about what my diet is around those meals. Now, considering the data we have is ever evolving, new data is being published each day, and new studies commence, providing the most up-to-date, pertinent, scientifically supported data to our compatriots and patients is of great import to optimize the health of our patient populations. So we really want to get into the idea of prevention, treatment, and recovery efforts. So I want to thank you for your attention. And if you have questions on specific dietary components, I would love to dive into that. But as this says, the ways in which this disease process impacts not only the person suffering, but our families is truly an aspect that keeps us very motivated towards finding better treatment options and eventually a cure. So, that questions.
Hi. Wow. What incredible presentations, Dr. Holland, Dr. Medavali. Is it Medavali? Is that how it's pronounced? And Kathy Kiefer. Thank you. Do you think oral glutathione is beneficial for decreasing inflammation?
I have heard of glutathione being beneficial. It's not something that I've studied in particular, but I know glutathione is necessary for prevention of, say, buildup of what's called NAPQI. And especially in relation to aldehyde dehydrogenase. Glutathione is good, but again, getting your nutrients through dietary intake is best. I will say that supplements are great to bridge gaps, and sometimes supplements are absolutely necessary. So again, as Dr. Mirabala said earlier, speaking with your primary care physician about how you're going to implement these things into your routine is ideal.
I was wondering about diet.
Yes.
I know anti-inflammatory and everything, and I purchased a couple of books that said anti-inflammatory diet, but I read somewhere that eating meat was inflammatory, caused inflammation. Mm-hmm. But when I bought an inflammation book, all of them had meat recipes. So I'm like, I'm not sure what I should be doing here.
Yeah, and that's a wonderful question, and diet does get very, very confusing. So when we're talking about meats in particular, there's going to be lean meats and there's going to be not lean meats. So a 70-30 burger where you're 70% protein and 30% fat, a lot of it is going to be trans fat. And that's going to be a lot more inflammatory. Whereas if you go to, I was at Trader Joe's the other day, and they had a 96-4. So 96% lean protein and 4% fat. Costco as well has quite cheap beef, and it's a 90-10 beef. Now when we're talking about meats in general, the ones to limit are going to be red meat. So that's going to be your beef and your pork. Poultry are very good, especially the lean poultry, but even better are going to be fish, but in particular, dark fatty fish, which is going to be your salmon and your tuna in particular. The reason those are so good is because they have high concentrations of omega-3 fatty acids, and the omega-3 and omega-6 fatty acids can increase your HDL. And HDL is the high density lipoprotein. It's a cholesterol, and it's the good cholesterol, quote unquote. And the reason it's good is because it can go into your vessels and actually scavenge the bad cholesterol and bring it back to the liver for processing. And it's a process called reverse cholesterol transport. Now, the bad meats, the ones that have high trans fats, are going to be pro-inflammatory. They're going to have high LDL content, and that LDL is the bad cholesterol, again, quote unquote. And that's the low density lipoprotein. And what that does is it actually goes into the vasculature and can cause the fatty streak, which then leads to a fatty plaque. And if that fatty plaque ruptures, then we have what's called an infarction or a blockage of that vessel. And that's why sometimes those meats can be inflammatory, but it depends on what you're intaking. And if I take a quick aside on microbiome, that also a huge impact on diet. So what we are consuming dictates our gut bacteria. And our gut bacteria can start modifying after about 24 hours, but it takes about a month to fully modify. The reason it's important is because that bacteria allows for the last component of digestion. So if somebody intakes a whole lot of fat and their microbiome, their gut bacteria is primed to digest that, that's fine. And then if they start intaking a salad, all of a sudden they get gas and bloating and abdominal discomfort. And all of a sudden they say, oh my gosh, I must have had bad food, or I got food poisoning. But it wasn't food poisoning. It was that their gut microbiome wasn't primed. But as you modify your diet and maintain, then your gut microbiome will modify and be able to digest those types of foods. So again, as I like to say, low and slow when you're making those modifications, and just listen to your body. I had an individual that decided to start taking olive oil, and we suggested 2 tablespoons a day. He just started taking shots of olive oil in the morning. And he said, I can't go out after noon. And I said, why not? He said, because I have to run to the bathroom and sometimes I don't make it. And I said, oh my gosh, walk me through your day. And he said, well, I wake up, I, hang out for a little bit, and then I do my 2 shots of olive oil. And I said, oh my gosh. Well, first, you've modified your diet and your gut microbiome isn't primed to digest that olive oil. Also, you're taking 2 tablespoons of olive oil in quick succession. It's oil. It lubricated his bowel. So I said, hey, go ahead and consume some whole grain bread with it and do it 3 times a day. So he was getting his whole wheat and he was minimizing his intake of olive oil at one singular time and spreading it out throughout the day. Hey, doing quite better.
Thank you.
Absolutely.
Okay, Dr. Miravalli, I'm going to combine 2 questions. Do you recommend listening to music when you experience cognitive overload? And with respect to music, another person asks, is this why I am able to move easier and walk with greater balance when music is playing versus when it is not?
Great question, both of them. Yes. So the music potentiates the benefits of exercise. And I think we all experience that. If you go to the fitness center and you try to work out, have you done that without music? It doesn't feel quite as good, right? So music potentiates. And there is a principle called entrainment, which, our brain tries to mimic and follow the rhythm of music, the tempo. So if you're listening to music with a fast pace, most likely you're going to move faster. So yes, music and exercise potentiate each other. In terms of using music for cognition, as long as it does not interfere with the process of attention. So one of the problems in multiple sclerosis is the processing speed is decreased. So meaning the speed in which the brain processes information. If you're adding music to whatever cognitive function you're trying to practice, it might distract you. So you have to find a way in which, if you need to pay attention to something, you need to have your work done, make sure that you limit all of the distractors that could be in the environment. However, music could be also a wonderful way to practice cognitive functions. And an example that I always give, now that I moved to Chicago, I introduced one variable in my life that I didn't have in Colorado called traffic. So now I'm sitting in traffic for half hour every day or more. So what I've been doing is listen to music, and I love classical music. And an exercise that I do is I listen to a symphony, and every day I listen to the same one. But one day I pay attention to the violins. And the next day I listen to the music and I pay attention to the flute. And the next day I pay attention to the cellos. So that way you're practicing that cognitive attention that is a function that actually we all have difficulty. So you can use music to practice cognition.
So would you advise to go to a nutritionist then? Because I find all these dietary things a little bit confusing. I want a meal plan, and
I think it's wonderful to find a dietitian. Registered dietitians have the educational background in particular. Nutritionists are great, but sometimes they don't have as much of the, let's say, hard science behind the suggestions. Certainly with a lot of these diets, the Mediterranean, the Mind diet, and DASH, their components are online. I specifically enjoy the Mind diet. It was developed by my mentor along with the PI, the principal investigator of one of the trials that I'm on. But I like it in particular because it's easy to score. It's out of 14. And the other aspect that I really appreciated about it is it doesn't say cut things out entirely. It says to avoid or limit these foods. So red meat, for instance, no more than 4 in a week. For fried fast food, no more than once every 2 weeks, so no more than 2 a month. It's not saying that you have to cut these out entirely. And for me, I personally prescribe to the idea of I don't want to have an all or none mentality when it comes to diet, because then I will have cravings. And if I have cravings, I'm going to have kind of an unadulterated intake. So making sure that I control myself is important. I can go have a miniature Butterfinger and just do one, but it satiates me to the point that I don't have to consume an entire candy bar. But if you do find it challenging or confusing, and especially meal prep or what meals to start implementing, I think it's a really great idea to seek out a registered dietitian if you do have that capability. But do you want to talk about?
Yeah, so we are planning, as part of our initiatives for education, we will have 3 live demonstrations on cooking. And Kathy, would you like to describe the details? So Laura Morris and Jennifer Bertrelli?
Correct. So over this summer, we thought this would be a good time. We offer monthly conversations in brain health, but during the summer, we're going to do, during June, July, and August, actual cooking demonstrations with the daughter of the founder of the Mind Diet. So she will provide a little bit of upfront explanation so that you have practical ways to implement a healthy diet, the Mind Diet, and she will provide cooking demonstrations to go along with it. So that information to follow, that will be offered through Rush and is available to anybody at no cost. Yeah, and actually, we do have flyers out in the lobby on the main table when you checked in. So with the MS Yoga Moves, your table there.
I passed out flyers to everybody when you came in. So there's so much information about podcasts and the brain health program. Thank you. Incredible. Dr. Miravalli, you're going to continue talking about MS research? Oh, yeah.
Okay.
Let's give him a minute to transition.
You want to take a minute?
No, I'm fine. I'm fine. I can keep going.
Thank you.
That was amazing. Thank you so much.